Cervical cancer is a type of cancer that develops in the cells of the cervix. The cervix is the lower, narrow part of the uterus that connects to the vagina. Understanding this disease is the first step towards protecting your health. While it is a serious health concern affecting many women globally, there's important positive news. Cervical cancer is largely preventable through vaccination and regular screening. This means we have powerful tools at our disposal to combat this disease. Furthermore, when detected in its early stages, cervical cancer is highly treatable. Early intervention significantly improves outcomes and increases the chances of successful treatment. This underscores the importance of awareness and proactive health measures. Understanding the risks associated with cervical cancer is vital. Knowing the potential signs and symptoms allows for timely recognition. Taking proactive steps, such as vaccination and regular screening, is crucial for prevention and early detection. The primary cause of almost all cases of cervical cancer is infection with the human papillomavirus, commonly known as HPV. This virus is widespread and affects a large portion of the population at some point in their lives. HPV is a very common virus. There are many different types of HPV, and most do not cause cancer. However, certain high-risk types are strongly linked to cervical cancer and other cancers. The virus is often transmitted through sexual contact. This includes vaginal, anal, or oral sex. Infection is very common shortly after becoming sexually active. Fortunately, effective HPV vaccines are available. These vaccines represent a major breakthrough in cancer prevention. They are recommended for both girls and boys, typically starting around age 11 or 12. These vaccines offer significant protection against the types of HPV that most commonly cause cervical cancer. Vaccination is a powerful tool to prevent infection and reduce the risk of developing the disease later in life. The available vaccines protect against the common cancer-causing HPV strains. By preventing infection with these high-risk types, the vaccines dramatically lower the likelihood of precancerous changes developing in the cervix. Early detection of cervical cancer is paramount for successful treatment. Identifying the disease or precancerous changes before symptoms appear offers the best prognosis. This highlights the critical role of regular health checkups. Regular screenings are essential tools in the fight against cervical cancer. These tests are designed to find abnormalities in the cervical cells before they become cancerous or at a very early stage. They are a cornerstone of preventive care for women. Screenings for cervical cancer include Pap smears, also known as Pap tests. During a Pap smear, cells are collected from the cervix and examined under a microscope to look for abnormal changes. This test has been instrumental in reducing cervical cancer rates. Another important screening method is the HPV test. This test looks for the presence of high-risk types of the human papillomavirus in cervical cells. Detecting the virus itself can indicate a higher risk of developing cervical cancer in the future. These tests work together to identify precancerous changes in the cervix. Precancerous cells are not yet cancer, but have the potential to become cancerous over time if not treated. Finding these changes early allows for intervention. The tests can also identify early-stage cancer. Finding cancer when it's small and confined to the cervix makes it much easier to treat effectively. Early detection is key to less invasive treatments and better survival rates. Regular screenings allow intervention before the disease progresses to more advanced stages. Treating precancerous lesions prevents cancer from developing. Treating early-stage cancer prevents it from spreading. It is crucial to follow your doctor's recommendations for screening frequency. These recommendations are based on medical guidelines and are tailored to individual risk factors. Skipping recommended screenings can delay detection. Screening frequency varies based on several factors. These include your age, your medical history, your vaccination status, and the results of previous screenings. Your doctor will determine the appropriate schedule for you. While regular screening is the best way to detect cervical cancer early, it is also vital to be aware of potential signs and symptoms. Recognizing these can prompt you to seek medical attention promptly, even between screenings. Do not ignore unusual changes in your body. Abnormal vaginal bleeding is a significant warning sign that should never be ignored. This is one of the most common symptoms of cervical cancer. Any bleeding that is not your normal menstrual period warrants investigation. Abnormal bleeding includes bleeding between periods. This might be spotting or heavier bleeding occurring unexpectedly during your cycle. It is important to note the timing and amount of any unusual bleeding. Bleeding after sex is another form of abnormal bleeding that can be a symptom. This is often one of the first signs noticed by women with cervical cancer. Any bleeding following intercourse should be discussed with a doctor. Bleeding after menopause is also considered abnormal and is a potential warning sign. Any vaginal bleeding after you have gone through menopause should be evaluated by a healthcare professional immediately. Postmenopausal bleeding is never normal. Unusual vaginal discharge should also prompt evaluation by a doctor. This might include discharge that is foul-smelling, watery, or bloody. Changes in the color, consistency, or odor of discharge can indicate an underlying issue. Pain during sex, also known as dyspareunia, is another indicator that warrants medical attention. While it can have many causes, persistent or new onset pain during intercourse could be a symptom of cervical cancer. Discuss this with your healthcare provider. Persistent pelvic pain that is not related to your menstrual cycle also warrants attention. This pain might be dull or sharp and can vary in intensity. If you experience ongoing pelvic discomfort, consult your doctor. Changes in bowel or bladder habits can also be associated with more advanced cervical cancer. This might include difficulty urinating or having bowel movements. These symptoms occur when the cancer has grown larger or spread. Leg swelling may occur in advanced stages of cervical cancer. This happens if the tumor presses on nerves or blood vessels in the pelvis. Swelling in one or both legs is a sign that requires immediate medical evaluation. Being informed about cervical cancer, its causes, prevention methods, and potential signs is empowering. Take charge of your health by getting vaccinated if eligible, attending regular screenings, and paying attention to your body. If you notice any of the signs or symptoms discussed, please seek medical help promptly. Early action saves lives. Please subscribe for more videos like this. Thanks for watching.